Welcome back to Complete Medical Coding, a complete CPC learning channel. It is important to learn and understand anatomical terms while doing coding. So today, let's discuss about some basic anatomical terminologies in the coding section. So let's have a look into it. So today, let's learn some prefixes and suffixes, which are the basics of anatomy. Some terminologies. So let's have a look into it. Mono or uni means one. Example, monocyte, unilateral. Bi means two. Example, bilateral. Tri means three, triad. Quadra means four, quadriplegia. Hex means six, hexos. Diplo, double, diplopia. Ambi means both, ambidextrous. Aniso, unequal, anisocoria. Dis, bad, painful, dysphoria. Eu, good, normal, euthanasia. Hetero, different, heterogeneous. Homo means same, homogeneous. Few people might be knowing all these anatomical terminologies, but I'm just still doing it for the beginners, those who are learning or those who are appearing for the CPC examination. This will be helpful to you. Although this is already there in the CPT code book, I'm just explaining one by one. Next, hyper means excessive, above. Hypergastric. Hypo, deficient, below. Hypogastric. You can see you might be noticing in some questions the patient is having hypergastric pain or hypogastric pain. So from that word you need to understand what exactly it means. Is it deficient or is it excessive? Okay. Now iso means equal, same, isotonic. Mal, bad, poor, malaise. This malaise word is important. You will use to get it in few questions. Megalo, this is also important. Megalo, large, megalocardia. Ab, starting with AB, means away from. Abduction, starting AD, adduction means towards. Ecto, this is also important. Ectoprion, endoprion, all these you will get while coding ophthalmological terminologies. Ectropion, all those terms. Okay. So exo means outside. Ectopic, exocrine. Endo means within. Endoscope. Epigastric pain. I just mentioned you like hypergastric, hypogastric. There will be epigastric pain. So means upon, epigastric. Infra means below or under, infrastructure. Ipsi, same, ipsilateral. Meso, middle, mesopexy. Meta, after, beyond, transformation, all this for meta. Metastasis. Peri means surrounding, pericardium. Retro, behind or back, retroversion. Trans, across, through, transvaginal. This trans retro is also important. Now let's look into some suffixes. Suffixes are more important than prefixes. You will get most of the questions from suffixes. Ending. Okay. Synthesis. The word ending with synthesis means puncture a cavity to remove fluid. For example, amniocentesis, removal of amniotic fluid. So like that, synthesis means removal of fluid. Ectomy, ostomy, otomy, all these are important terms. This first page is very important, suffixes. Ectomy means surgical removal or excision. For example, appendectomy. Appendectomy means removal of appendicitis. Cholecystectomy, removal of gallbladder. These are the examples. Okay. Ostomy. Ostomy means opening, a new permanent opening. Wherever you see ostomy, see colostomy. Wherever you see ostomy, it means opening in the colon or opening in whichever part. Okay. Ostomy. Now, otomy means cutting into or incision. Cutting means otomy. Opening means ostomy. So, otomy, cutting into. Tracheotomy, cutting into the trachea or an incision into trachea. That is called tracheotomy. A physician undergoes tracheotomy, like that only you will get questions. So, you need to identify if it is an incision is being done or excision is being done. Okay. Now, oraphy means surgical repair or suture. Repair is called oraphy, herniorrhaphy. Opexy means surgical fixation, nephropexy. Oplasty means surgical repair. Oplasty, otripsy, these are also important. Oplasty means surgical repair, rhinoplasty. Otripsy means crushing or destroying. For example, lithotripsy. Algia, myalgia means pain. Neuralgia, algia means pain. Asthenia, weakness, myasthenia. Emia, wherever words ending with emia, it means it's related to blood. Anemia, leukemia, all these are ending with mia, emia. It means the condition which is related to blood. Now, aiasis means condition of amoebiasis. Now, itis. This is also important. Itis means inflammation. Appendicitis. Okay. Itis. Lysis, destruction, breakdown, hemolysis. Lytic, destroy, breakdown, hemolytic. These both are almost same. Lysis and lytic. Oid means like. Lipoid. Oma, tumor. Carcinoma, wherever ending with oma, it means it's a tumor. Carcinoma. Okay. Opathy, disease of arthropathy. Oralgia means hemorrhage, bleeding. Menorrhagia. Urea, flow or discharge. Amenorrhea. Oocyst, abnormal condition of tuberculosis. Paresis, weakness. Hemiparesis. Plasia means growth. Hyperplasia. Plegia means paralysis. Paraplegia. Apnea means breathing, something which is related to breathing. Sleep apnea, apnea, nia. Ending nia, it means it's related to breathing. Now let's move on to some words and the meanings. These are also important. Word and their meanings. This is about the human body. Anterior, like the position, okay? Anterior or ventral, another name for anterior is ventral. Means at or near the front surface of the body. If it is near the front surface, it is called as the anterior. And if it is near the back surface of the body, it's called as the posterior or dorsal. Okay. Then superior and inferior. Superior means above, inferior means below. Now, lateral, distal, proximal, medial, all these are also important. Lateral means on the side portion of the body. Distal means farthest from the center. Distal, farthest, and proximal means nearest to the center. Medial means middle. Supine. Supine position. The physician examined the patient in a supine position. Means face up or palm up. Supine. Prone means face down or palm down. Okay. Facing up. Like lying down, facing up. That is supine position. Lying down, facing down is prone position. Now sagittal, vertical body plane, divides the body into equal left and right sides. That is a sagittal plane. Vertical body plane, vertical, okay, divides the body into equal left and right sides. Transverse means horizontal body plane, which divides the body into top and bottom sections. That is transverse. Coronal means again vertical body plane, which divides the body into front and back sections, like this vertical, vertical body plane divides into front and back sections. That is coronal. Vertical body plane which divides left and right is sagittal. Now I'll show you these body planes, some pictures of the body planes, so you will be understanding it more. See, body planes 3/4 view. This is a 3/4 view of a body plane, which shows the sagittal plane, coronal plane, and the transverse plane. What represents the sagittal plane? The coronal plane and the transverse plane. Transverse like this. This is a 3/4 body plane view. Now, side view. This is a side view. Superior, posterior, anterior, posterior or dorsal. See, back side. Anterior or ventral. It's a front side. Okay. Posterior or dorsal, back side. Anterior or ventral, front side. Superior means on the top part. Then inferior, down. Lateral, proximal, distal, medial, all these are mentioned in this side view. These are the side views. Okay. Now front view. Front view, body planes, front view. See, from here you can identify the proximal, distal, inferior, lateral, anterior, ventral, medial, all these will be getting in, you can notice it in the front view. The anatomical terms it's just mentioned for your reference. Okay. So these are some of the basic examples, some of the very basic anatomical terminologies. So on the next episode, I'll be explaining more anatomical terms, anatomical terminologies. Let's take some anatomical classes. Then we will move on to the 40,000 series. Okay, because anatomy is also more important. So let's see in the next episode as anatomy part 2. After finishing anatomy chapters, we will do some practice questions which are related to anatomy. Okay. So friends, that's all for today. And thank you so much. If you like the video, please like it and share it. And please subscribe to my channel. Thank you. Bye. See you in the next episode.